Everyone, welcome to our Tuesday morning update in regards to COVID-19 in the Murrumbidgee Local Health District. Now, good news first is that there's still no new cases, so the confirmed number of cases will remain at 45, and there is still currently 2 patients recovering. And the reason for that is because the case definition has changed, and pretty much to be recovered now you have to be 100% back to baseline before you contracted COVID disease. So you may be aware that there will be some patients who will develop a post-viral cough, and that has to actually clear up completely before we classify you as recovered. Now, as I said on Thursday, once again we need to thank the community. They've done a magnificent job in presenting for testing. We've tested almost 7,500 patients, and 431 of those were actually done by the mobile testing clinic. So that's great. They'll be in West Wyalong today, and then they'll be spending days in different parts of the district the rest of the week and ongoing next week. It really is important that people present for testing, even if they have the mildest of symptoms. And I'm sure you're sick of me saying it, but just a runny nose or a scratchy throat, if you've got a temperature, call the COVID hotline and we'll arrange testing for you. And the other important bit though is that once you've presented for a test, you need to self-isolate until you have the result back. And you cannot assume that your test result is negative, and everybody that presents for testing will be notified either via a phone call or a text message what your result is. Should you have a positive test result, you'll be contacted by the public health unit, and then we hope that you'll have the COVID Safe app on your phone so that we can trace your contacts to make sure that we protect the rest of the community. One of the other questions we've been asked before is, should I be tested more than once? Now, we are moving into the winter where we will have lots of different respiratory illnesses. You can go and be tested more than once. So in other words, let's say you have symptoms today, we test you, you recover from what could be the common cold. In 3 weeks from now, you develop symptoms again. It really is important that you present for testing again. I know it's not pleasant, but luckily our team is getting lots of practice, so they're really good at it. But it is important that the way for us to beat COVID is with testing and with a public health initiative. We need to make sure that the virus doesn't spread. So that's my update for today. So what we'll do is we'll let the other speakers do